Now, the HSE is running a campaign over winter 2020 and next spring as well to ensure that people prepare for their winter health needs as best they can.
Yes, it's all about knowing how to look after ourselves and where to go if we need extra help. And here to give us a bit more information, we have Dr. Vida Hamilton, the HSE's National Clinical Advisor. Dr. Vida, you're very, very welcome to the show. I suppose things are have been so strange for the past few months that we don't really know what normality is anymore. And when it comes to the emergency departments, are they open and how are they working?
Yeah, so our emergency departments are all open and working, and we've had to learn a lot of new ways of working because of the COVID pandemic. And one of the key changes you'll find when you come to our emergency now is before you even register, you're met by a senior decision maker who takes a brief history and then directs you either through a COVID pathway or to a non-COVID pathway. So before you barely enter the door of the hospital, people with symptoms and signs of COVID are directed towards services that will look after them, and they're kept separate from patients who are presenting for non-COVID healthcare needs. And the key important thing about that is that we want to assure the population that our hospitals are there, they're safe and they're open to look after you, no matter what your healthcare needs are, COVID or non-COVID. One of the big fears that people have had is that people will be too scared to go to the hospital when they've got important time-dependent problems like heart attack or stroke. And it's really important that people with those signs or symptoms attend as quickly as they can so that they can get the care that they need to give them the best opportunity not only to survive, but to survive with a really good functionality and in really good health.
That's great, Dr. Vida, to give us some feel for what the experience would be like if you were to end up in the emergency department, you know, in the coming weeks and months. But if you did need to go, what is the policy with regards bringing someone, like if you really needed to have someone with you for whatever reason, where do people stand?
Well, the first thing, if you do become unwell, the first thing that you should do is to call your GP. And even if you don't have a GP, if you're concerned you may have COVID-19, you can phone any GP in the locality. They'll look after you. There's no cost to the individual for doing that. The GP will go through your signs and symptoms with you. And if there is a concern you may have COVID-19, they'll organise a test for you. Or if they are concerned that you're so unwell that you need to go to the hospital, they will straight away, they will assist in getting you to the hospital as quickly as possible, either because you have somebody with you who can drive you, or if you require an ambulance by facilitating that. If you are concerned that you're so sick that you need to go to an emergency department directly and you have someone who can bring you, that's fine if you have non-COVID symptoms or if you're terribly unwell and you feel you need urgent medical attention. But if you are coping at home and able to walk around the home, then it's appropriate that you phone your GP first. In terms of visitors, as part of the new ways of working to try and keep people safe in the hospitals, we're trying to minimise the footfall and to prevent overcrowding in the hospitals. So we're asking people not to bring visitors or carers with them unless they have a medical indication for having a carer with them. So you may have somebody drive you to the hospital, but we will be asking that person to stay in the car and for the person who's seeking attention to attend on their own. And as I said, that's so that we can manage the infection prevention control practices, which, as you know, are hand hygiene, wearing a face covering, and maintaining social distancing. If we have overcrowding, we can't deliver on that social distancing to keep people safe.
Dr. Vida, if you're bringing someone to the emergency department or if you're going yourself, should you call ahead?
in an ideal situation, you should contact your GP or a GP first, because they may be able to offer care alternatives in the home. But if you need to go directly to the emergency department, there probably isn't a facility in a lot of our emergency departments to take phone calls from patients phoning ahead. But when you arrive at the emergency department, as I said, there's a senior decision maker right at the entrance of the hospital who will direct you towards the appropriate service, be it a COVID or a non-COVID service. And, you know, in some instances, that appropriate service may be to redirect you back to your GP.
Okay. And what about outpatient appointments, Dr. Vida? Are they still carrying on as normal?
Yeah, so we've once again we've changed the way we do things, and we're using a lot more virtual clinics. So that can either be through a video conference, a bit like we're doing today, or it could be through a telephone interview, and that's most suitable really for return follow-up visits, but can occasionally be used for a first visit too, and that just has the advantage of a person not having to travel outside of their home. They can have the interview or the clinic appointment in the comfort of their own home. And of course, with all the good infection prevention control practices that allows. It's not for everybody, and you don't have to have one. You get offered a virtual clinic, but if it doesn't suit you, you can say you'd rather have a face-to-face clinic meeting. And of course, there are times when having a virtual outpatient appointment isn't suitable because you need to have a physical examination. So you'll be invited into the hospital to do that. And what we do when you're attending for a face-to-face appointment, we check to make sure that the individuals attending don't have any signs or symptoms of COVID-19, nor are they a close contact of somebody with COVID-19. And the same thing again, we ask that people don't bring a carer or a visitor with them unless they have a medical indication for needing somebody with them. And we ask them to use hand hygiene, wear a mask, and to maintain all those important social distancing requirements that are so frequently talked about.
Dr. Vida, I'm holding here a lovely little booklet, and it is called Keeping Well This Winter. Tell us about this.
Yeah, I have a copy of it here myself, and it's been sent to every house in the country. And it's actually a very useful source of information. I mean, winter's always been challenging, and I'm occasionally talking in the media in the non-pandemic winters about the importance of preparing. Over the holiday periods, there's often periods of time when it's difficult to access, pharmacies. People are on holidays or bank holidays or whatever. So to have your prescriptions stocked up, it also means that if there is a severe weather event, that you're not trying to go out and putting yourself at risk of fall for urgent medications because you've run out. So really important to plan ahead. Make sure you've got your prescription. The pharmacists are a really marvellous source of information for minor injuries, minor illnesses, and explaining your medications and their side effects. But if you think you've COVID-19, don't go to your pharmacist, okay? Yeah. Stay at home. If you need medicines, if you need medicines like paracetamol or ibuprofen to help make you feel a bit more comfortable, get a loved one to pop down to the pharmacy for you and bring it back and leave it outside your door so that you don't share the disease with anyone.
Dr. Vida, thank you so much. That's all such helpful information. We really appreciate it. Thanks so much for your time, and take care of yourself, and happy Christmas.
Merry Christmas to you.
Very happy Christmas.
Thanks
Stay well.
A million.
Yeah, just to say as well, Tasha and Gael and August and Mirla in English and in Irish, all in the one.
Very
all
important.
One booklet, yep.
Good to have it that way. And remember, if you or anyone you live with becomes ill over the holidays, as Dr. Vida said, contact your GP. And if you'd like any more info on anything we spoke about just there, just check out hse.ie.